We looked at over 18,000 patients, and we wanted to understand, or the hypothesis that we were trying to understand is, would patients wear when they wear a patch-based monitor like the Zio patch, that do they wear it continuously? And what is the quality of the signal? And it's based on, the hypothesis is based on other monitoring modalities don't stay on the patient's body. Because of the logistics, patients have to change the electrodes. There's lead wires. They have to charge the units that the patients have. The devices come on and off the body. But with a patch-based device, I really wanted to research and understand, does the patient keep the device on their body during the entire wear time? And in this cohort of over 18,000 records, what we saw is that the patients, we can actually measure compliance, or patient's compliance with the device, with a metric that's called leads on detection. And the way that we measure that is through a second channel in the Zio patch. And again, this is the Zio patch. And a patient would wear the device just on their upper left chest for up to 14 days. And there's a channel in the device that we're actually able to measure the skin impedance, and that's called leads on. And I wanted to look at, does it degrade over time? Does that compliance with the device degrade over time? So if they're wearing it for 14 days, is that device coming on and off the body? Like we know other modalities come on and off the body, so you don't get a continuous view of what's going on. And what we found is that across all of the time increments that we looked at, so day 0 to 1 days, 2 to 4 days, 4 to 7, 7 to 10, and 10 plus days, what we saw is that 100% of the wear time, the patients actually have the device physically on their body, which says this device, this wearable biosensor, is really comfortable to wear and easy for the patients to use. You know, we've heard it anecdotally from patients that they just forget about wearing the device. They have it on and they go about living their life. But lo and behold, we now have the data to support the anecdotal data that says, yes, this device is very comfortable to wear, and patients are really compliant with the device. So 100% of the time, the devices were physically on the patient's body. And what we looked at is the quality of the signal. So it's great if it's on, but is it capturing really good data for the physicians? And indeed, 98% of the wear, or 98% of the data that's collected is analyzable, which drives us to a really great result for the physician and for the patient. We see a diagnostic yield, or when we rule in an arrhythmia, 72% of the time those records have an arrhythmia in it. So we are trying to gather information about arrhythmias that helps the physician diagnose, and we believe that the Zio patch should be the first line test. There's a lot of modalities that are out there that are really cumbersome for the patient to use, but because the cost is, this is the most cost-effective test, those other devices actually cost 2 to 3 times the cost of the Zio patch and are not delivering the same quality of data. They deliver that snippet of information, that what I call a binary answer, yes or no. Do I have it? Do I have an arrhythmia? Yes or no. What the Zio patch does is show you yes and no. Yes, you have an arrhythmia, and guess what? Now we can show you the amount or the burden of the arrhythmia that's present, which is really important in atrial fib detection and particularly important in strokes. Right now, it is indicated by the FDA for adults, so 18 and over. So again, we do see some physicians in off-label use it in the pediatric community, but primarily it's really about 98% of all of our usage is in the adult population. What we do in our labeling is that if a patient has an adhesive allergy, so really can't tolerate any type of adhesives on their skin, they couldn't handle the patch electrodes, oops, sorry, couldn't handle the patch electrodes, they really are not going to tolerate a Zio patch well. But you know, that type of patient is very hard for the physicians to deal with. So again, we may see off-label use because it's the only tool that a physician can use. We really don't advocate it. It's uncomfortable for patients who have adhesive allergy, and we ask that the patients are screened prior to it. Basically, because we really wanted to take the burden off the patient, and our core value is of creating simple and elegant solutions for the patient. So with that, all the data is stored on the device. The device is returned back to us because every patient still has a postal service access. The device comes back to us, and again, very successful in over 300,000 patients of using that system. We then take that large data file, that continuous data file, move that data up into the cloud, analyze that data very quickly, and then bring it back down to earth, as I affectionately say, and that it actually is then curated by a clinical team, very experienced, highly trained clinical team that actually put the information together, and it's very succinctly reported in this format that the physician can then see, just even from the front page, was there anything present? Do I need to go drive further into the report to find out more information about that particular patient? With the recent Anthem breach, every provider needs to be worried about the safety and the privacy of their data. Everyone, and at iRhythm, we take it just as seriously. We are considered a covered entity under the HIPAA designation, so we strive to make sure, and every single day we worry about how do we protect our patients' data? How do we protect the information that the physicians have trusted us to handle? And it's a real concern today, and we all need to be vigilant to really focus our practices on safe patient information.